as with everyone in New York and across the country, it's just really stressful. I represent parts of Queens, which is the hardest hit county in all of the state. You know, yesterday across the city, we had our highest number of deaths. And we are told by projections that it'll just keep getting worse till the end of the month. We need more support. And obviously, it's Elmhurst Hospital specifically has been in the news. It has been one of the earliest and hardest hit hospitals. I fear that this will happen to other hospitals in the city and even around the country. So we want to make sure that we are getting the help it needs as soon as possible. Lives are needlessly being lost. We've heard stories, and this is not just at Elmhurst, we've heard stories from people who work in the ICUs and the ERs where they say, okay, today we had enough available ventilators, but we didn't have properly trained staff to operate them. Last night I heard a story, and I don't want to name the hospital yet because I've only heard it from one person, but a doctor reached out saying that there was a woman in her 50s. She's on a ventilator. They simply don't have enough staff to operate it. And I don't know the proper terms, but if they don't have someone within an hour or two to help her, then she'll probably die, and she doesn't need to. So that's just one story that, you know, happened to reach out to me directly. I don't know how many stories there are like that throughout my district and throughout the city. We're just trying to make sure that we are hearing the voices of the workers inside, so that we can try our best to get them the help that they need. I'm super concerned. You know, one of the first calls that I got from one of the ER doctors in one of our local Queens hospitals was, he was telling me that him and his coworkers cry every day, that they just expect to die. You know, I've heard from local lawyer friends who say that they've been having a lot of reach out from people, you know, in their age range, people in their 30s, 40s, 50s, who are realizing that they might need to make preparations and write a will. So look, even if things go well and they survive this, the mental health, you know, they've never dealt with a situation like this.
What's the biggest concern you're hearing from your constituents right now?
So there are a few. I feel like one of the most pressing ones are the lack of supplies for our frontline workers. They are the top priority now, but there are also other workers who are considered essential and aren't able to stay home, and they're not healthcare workers, but they're also starting to get sick. So like our transit operators, our grocery store workers, pharmacists, you know, these are some folks who are starting to get sick, and we've had a few deaths in the transit world as well.
What is an issue as it relates to COVID that is keeping you up at night right now?
I think it's the fact that we can't get enough equipment for people and that we're losing people needlessly.